welcome or welcome back to Jen's Hangout. If you're new here, welcome, welcome, welcome. I have lip oil all over my face, apparently. Anyway, what is today? Today is a Talk About It Tuesday. So I'll just do this for my thumbnail. Anyway, and you guys know that I do my skincare while we talk about it. What are we talking about today? I'll give you a very brief update of what's been happening with me on this hysterectomy journey. And it has turned into quite the journey. We'll just say that. The surgeon ordered the first surgeon. That should tell you something. The first surgeon ordered a contrast CT scan because she wanted to really get a good picture of everything, or at least that's what she told me. Okay, so I've already done a toner and face mask, obviously, if you watched Monday's video. So we're going to go in with the serums, the things, you guys know, the usual. I have added a serum, the polyglutamic acid. That's what it's called. Anyway, so she ordered the CT scan. I went and had it done, and that was a whole big fiasco because of other reasons. She then called me the week after. This conversation did not even last 5 minutes. It was supposed to be a phone conversation because, I mean, it's not like she had to see me to go over CT scan results. Anyway, so she said it was a simple cyst and I was too high risk. And she was not going to do the surgery. And I think I had told you guys that we had the feeling that she was going to bail on us. But she didn't even bother to give me a referral. She lied to me instead. She put some false cardiac information on the notes, and then she also stated in the notes that she did not think I could mentally handle the surgery. This would have been, I don't know, surgery 18 or 19 for me. I have a very good support system for surgery. Very good, professional and not professional. So my aftercare is not a concern, right? I mean, I get that it's a concern, but it's not a concern. That part is taken care of. Anyway, so that was a really big fiasco. So I let my regular doctor know. He put in a referral to a different hospital for a second opinion. Then I went and saw my OB. And that was a fiasco of an appointment, but not on, I mean, anyway, she's a good doctor. I'm not saying that. So she said, that doesn't make any sense. It's very obvious that she agreed with us in that the surgeon never looked at the new CT scan because my cyst is not simple and I'm not that high risk. I mean, I'm high risk, yes, because I have diabetes and I've had heart surgery and all of these things, but that does not make me inoperable. But the reason we say that it was very obvious that she did not read the CT scan, my cyst has grown since I saw her, and not just a little bit. So that means that it's not just a simple cyst. It's not cancerous, as far as we know. Obviously, they won't know that until they go in and pull everything out for sure, 100%, and send it to pathology. But from everything we see, blood work, all that, it's very benign. It is just a cyst. But that does not mean that it is simple, nor is it okay to have in my body to just burst on its own. I knew this, and my OB and my regular doctor all know this. So my OB has referred me to the same surgeon that my regular doctor referred me to, but with a much more urgent note. And also to a general surgeon to try and have basically 2 surgeries in one. They'll have me knocked out. I have a hernia. I don't know if you guys know my history or if I've even spoken about it. A few years ago, several years ago, 2003, I ended up with an umbilical hernia, my belly button, very large. I mean, like sticking out of my belly, probably a good 6-8 inches. It was huge. I had surgery on it back then. Surgery failed. They did it laparoscopically, and it failed right away. The mesh didn't stay, none of that stuff. Anyways, so 17 years later, I had a repair done. I was in surgery under anesthesia for 8 hours for them to repair, for them to clean out the old stuff, all the old mesh, all the old tacks, all of the stuff, and as much scar tissue as possible. They ended up taking about yay much of my outside skin to try and get to good new skin because of the scar. Anyway, so they did a beautiful job, but now I have a hernia at the very, very, very tippy top, so like right here, of I have a strapless bra on, and it's not very uplifting. It's comfortable though. Anyway, so it's peeking out of the very tippy top of the mesh from the new hernia repair that I had before. So I need a new hernia repair. And so they're going to try and get it to where I can have both of these surgeries done while I'm under, and just have one surgery, if that makes sense. So that's the hope. That's what's going on right now. She also put me on, she ordered hormones, so I'm looking forward to that. Maybe I can stop feeling like I am batshit crazy and losing my mind and need to be locked up in a loony bin. I mean, I know I'm a little on the edge of crazy regularly, but this is nuts. And the hot flashes and the acne. I had cystic acne as a child, and so this, I was praying for everything but acne. Was for menopause and perimenopause. Anyway, today, speaking of perimenopause, what are the symptoms of perimenopause? Perimenopause can start when you are 35 years old. 35 years old. Are you crazy? But especially nowadays, and with all the processed foods, the chemicals that we pump into our body, and all of the just the hormones in our food, the soy, the phytoestrogens, all the things, right? The more processed food you eat, the worse health you'll have. It's not food. McDonald's is not food. It is poison. And it can affect this. It affects your hormones greatly. So the first one is irregular periods. Well, if you have PCOS, you already have irregular periods, so that's out the window. Hot flashes and sleep problems. If you have PCOS, you can have hot flashes. I have. When my hormones were at their peak worst, before I really started doing all the research to, calm that down. Inositol, things like that. Vitamin D. But with perimenopause, hot flashes are common. during perimenopause. Oh my God, just give me a walk-in freezer, please. And it's 92 degrees today. So we got the air conditioners in the windows just in time because I was dying yesterday. Anyway, I was losing my mind. And of course, when you have a hot flash, that makes you crazy. It's the only way I can really describe it. I mean, you are like irritable for the stupidest things. You feel horrible. Anyway, and sleep problems. And insomnia is a fairly common thing with PCOS, but it is drastically exacerbated with perimenopause. I've had more sleep problems in probably the last 2.5, 3 years, and not just due to my pain levels and my spasm levels and all these different things, but just not being able to sleep. So the intensity, length, and frequency vary of both of these things, hot flashes and sleep problems. Sleep problems are often due to hot flashes or night sweats, but sometimes sleep becomes unpredictable even without them. And I will totally agree with that. If you guys didn't know, if this is the first episode that you've watched, I only have like one other one, but we are taking information, I'm reading information from the Mayo Clinic, and I have it linked down below in my first video. I will try to remember to link it down here, because this is the most concise that I've found, right, for a lot of it. I mean, these are obviously your generalized ones. I mean, there are crazy enough ones. Inner ear itching is one. So if your ear itches on the inside, you are probably in perimenopause or menopause. So, mood changes. What were we just talking about? Mood swings, irritability, and increased risk of depression may happen during perimenopause. And if you have PCOS, you're already at a very, very, very high risk of this. So add in perimenopause, your hormones are going bonkers. A lot of women have been misdiagnosed with bipolar, and in fact, they don't have bipolar. They have PCOS. So, something to consider. The cause of these symptoms may be sleep disruption associated with hot flashes. Mood changes may also be caused by factors not related to the hormonal changes of perimenopause. Okay? Vaginal and bladder problems. Sorry guys if you're watching. When estrogen levels diminish, your vaginal tissues may lose lubrication and elasticity, making intercourse painful. I mean, you just kind of dry up. They used to call them shriveled up old ladies. Well, there's pretty much a reason why. Low estrogen may also leave you more vulnerable to urinary and vaginal infections. Loss of tissue tone may contribute to urinary incontinence. Yeah, I mean, I think if you are in menopause, perimenopause, then you know this. It's more than just leaking when you sneeze or cough, you know? So, and it can be worse the more children you have had. Something to think about there. Decreasing fertility and ovulation becomes irregular. Your ability to conceive decreases. I will say, just a side note, unless you have PCOS, it kind of flips the script. Many, many, many women who have PCOS have become exceedingly fertile in their early to mid 40s. There have been women, there have been like world record breaking women that have had babies in their 60s. But it is very common to get pregnant if you have PCOS naturally between 42 and 46 years old. Very common. So something to think about if you have PCOS. However, as long as you're having periods, pregnancy is still possible, if you wish to avoid pregnancy, using birth control until you've had no periods for 12 months. I personally, especially if you have PCOS of any kind, whether it's mild or extreme like mine, don't do birth control. Don't do birth control ever. It took me a lot of research to agree to the hormones, the hormone replacements, because it's dangerous and it's not an exact science. But I can't keep feeling like I'm going to lose my mind. So there we go. And I've changed everything that I can change on my end. Food, like I said, food, diet makes a huge difference. Taking certain supplements also makes a big difference. Things like that. So that's something to think about. But in PCOS, it is very much not uncommon for your periods to regulate and to become pregnant in your late 30s to mid 40s. Changes in sexual function during perimenopause. Now, mind you guys, I'm not a professional. This is all anecdotal evidence plus the information we're getting from the Mayo Clinic. And this is not advice, really and truly. Do with it what you will. Changes in sexual function during perimenopause, sexual arousal and desire may change. But if you had satisfactory sexual intimacy before menopause, this will likely continue through perimenopause and beyond. I don't think that's true. There again, anecdotal evidence. I don't think that's true. I think that's just male doctors trying to make it sound like, oh, it doesn't matter. We can still have sex. Because, women's health doesn't matter. Loss of bone. With declining estrogen levels, you start to lose bone more quickly than you replace it, increasing your risk for osteoporosis and osteopenia. Osteopenia is what happens before osteoporosis, a disease that causes fragile bones. So, and then changing cholesterol levels. Declining estrogen levels may lead to unfavorable changes in your blood cholesterol levels, including an increase in low density, so LDL cholesterol, and which they classify as the bad cholesterol. Do some research on cholesterol, people. Really, your brain is made from cholesterol. Cholesterol heals your cells. Just some facts there. Do with what you will. And they're trying to say that it increases your risk of heart disease. When I say do your research, people. Please do your research. Because there's been an over 40-year-long study. Actually, there's like 3 of them to prove otherwise. Or that have proved otherwise. While trying to prove that it does increase and it doesn't. At the same time, high density cholesterol decreases in women as they age, which also increases the risk of heart disease. Something also, just a little side note, as being a 20-year diabetic, something to factor into your cholesterol, and I don't take too serious. I'm not saying I don't take my health serious, you guys. I take my health very, very serious, but I've done a lot of research, and I suggest that you all do the same. And that doesn't mean Wikipedia, because anyone can put shit on that page. Don't. Actually go to reliable sources. Look up real research studies. Get the PDFs, download them, and read the research results. Because they have found that lots of different things. I totally just lost my train of thought. Mother effer. Oh, triglycerides. That's what I was thinking of. Triglycerides fluctuates with what your blood sugar does. So while you could be fasting, your blood sugar could still be slightly high and your triglycerides are going to read through the roof. You go in when you are on the low end of your blood sugar and they could read normal. Triglycerides fluctuate literally multiple times a day. It's just what they do. They are affected by blood sugar. So, something to think about. When to see a doctor is when your symptoms become very severe to the point to where they are interfering with your everyday life. Go see a doctor about it. When they just become completely unbearable and you're at the point like me where I feel like, lock me up in the loony bin because ain't nothing gonna help this crap, go see the doctor. If your sexual function changes and you feel that's important, mood swings, go to your OB first. Do not feel like you're batshit crazy, because you're not. You're just hormonal. And hormones can burn. Something else to consider that can increase your menopause symptoms earlier is smoking. The onset of menopause occurs 1 to 2 years earlier in women who smoke than women who don't. So if you do smoke, quit. I did it. January 26, 2018 was my quit date for that. And let me tell you, hoorah, I am so glad. Family history, obviously, if they have early menopause in your family, then that's something to look out for. Cancer treatments, chemotherapy, pelvic radiation, anything like that, especially in that area, can increase how quickly you get menopause. And obviously the big one is a hysterectomy, a full hysterectomy, where they take your ovaries. And something I will say from personal, not my personal experience, but family history, is my aunt died from ovarian cancer 10 years after she had a hysterectomy. And so this is a very common thing. It's not something that they like to talk about. But if you're going to go in and you're going to get a hysterectomy, I highly recommend that you just get it all taken out. You're better off health-wise, because the risk of ovarian cancer is stupid high, because they also do chemotherapy. So you're at a huge risk. Anyway, so irregular, and I'm not saying they do when you have a hysterectomy, they do chemotherapy or radiation. No, when you get cancer, they do. Anyway, so the complications are irregular periods. If you are regular, irregular periods is the first sign, the first real sign that you are going into perimenopause. Most of the time it's normal, nothing to be overly concerned about. But if you have extreme bleeding, where you're changing your feminine hygiene products every hour or more, that is something to consider. If your bleeding lasts longer than 7 days, if your bleeding occurs spotting in between periods, and then your periods recurring less than 21 days apart. Stuff to consider. So there's your food for thought for this Talk About It Tuesday. Let me know if you guys have any suggestions for other Talk About It Tuesdays. I think we'll continue, obviously, on the updates with my health, but I think we're really going to dive into the PCOS on the next one, because I think that's so vitally important, and it piggybacks on to the perimenopause stuff. So, blessings to you all. I love you guys so much, and I hope you guys have a fantastic, wonderful week. And I will see you guys later. Bye.